Hi, welcome to the section of cardiology. This is Dr. Jaitly. In this video vignette, I'm going to be talking to you about what is stroke and is there a connection between the heart and stroke? Well, obviously we know the heart is a circulating pump that's constantly sending blood across the aorta to the rest of the body, from brain to the tissues in the lower extremities, and the blood keeps circulating all around. Blood has a capacity to be fluid as well as to clot, but there is a balance that's commonly present between the coagulative factors and the bleeding factors, if you will, through the blood. So the blood stays in a fluid state throughout the system. Now, there are certain places where the blood can or has a tendency to clot more. Now, we discussed plaques at a different video presentation, but just to refresh, now looking at my left panel here, you see there are two arteries which are going up the neck supplying the brain. One of them is called the right carotid artery, which divides into two. The internal one goes to the brain, the external one goes to the right side of the face. This is the left carotid artery, which is on your left side of the neck, and similarly divides into two, one going to the internal carotid artery and the other one going to the external, supplying the left side of the face. Plaques can form anywhere within the artery, just like the coronaries we discussed at some point, where there are plaques or arteries in the lower extremities or elsewhere. So the plaques, when they start to form, because of the lipid-rich material that accumulates at certain areas within the artery, they could get dislodged either by a rupture or by a clot formation. And when the clot forms, sometimes the clots can break and then go inside the brain, which are very, very fine arteries now by the time they get to the intracerebral level, if you will, and they get an obstruction. An abrupt cutoff of blood supply in that region of the brain results into a stroke, which is also called brain attack. Now, the clots, most of the time they're originating from the carotid artery, but also within the arteries, within the intracerebral arteries. Sometimes it's a bleed, that the arterial bleed has occurred, either because of a very significant hypertension, or there is an inherent tendency for that artery to bleed because of an AV aneurysm, which is a congenital presence of a fistula, if you will, within the brain. Now, the clots can also move from the heart. Let's look at on the right side of my panel. Now, this is my favorite prototype of the heart, as usual, so which explains a lot. So in the left atrium, predominantly, a clot can form if there is an arrhythmia called atrial fibrillation. Whenever there is a low flow syndrome, like in heart failure, where the flow is lessened, or when the clots can form within the left atrium, they can get dislodged at any time, and they pass through the mitral valve into the left ventricle, and the left ventricle sends it up in the aorta. And the moment it goes into the aorta, it can go anywhere from head to toe. So when it goes to the brain arteries, if it travels within the carotid on either side, it can result into a stroke also. Those are called embolus or emboli in plural. So these are dislodged clots from a distant source like a heart. What are the symptoms now? How do we recognize stroke, right? Well, weakness in the arm, the legs, the fingers, the numbness, these are the commonest signs or symptoms that the person will say that he or she is not able to pick up the pen, not able to pick up the coffee cup, or not able to write, or has noticed that there is a slurred speech, there's a facial drooping or drooping of the mouth. When the person is beginning to eat, the food just drools, etc., etc. Also, the person can complain of vision or hearing loss with blind spots, and there is an imbalance of gait because of the weakness in the arms, and the equilibrium or the balance sense could be lost. Patient tends to fall, has a severe headache, which is unexplained by any other means, and a severe headache should always warrant another alarming symptom. Nausea and vomiting can occur, and if the stroke is very, very significant or severe, then obviously a seizure or a loss of consciousness can result. Any of the above symptoms are extremely alarming, and they should be considered as an emergency, and one should call 911 to move the patient to the hospital immediately. Why? Because the recovery of the stroke is totally dependent on the speed of treatment that's offered to the individual. So in a nutshell, it's an emergency. A stroke results from a cutoff of a blood supply abruptly to the brain artery. Most likely it's from the clot or the bleed, or sometimes a migrant clot we call an embolus. So you've learned the alarming symptoms, obviously, but just recognize these symptoms immediately and move the patient to the hospital by calling the ambulance. We'll be discussing more intricate stuff on stroke at a later time, so stay tuned. Thank you for your attention. Bye.